We recently had a young man, 15-year-old boy, who had aortic valve stenosis. He needed an aortic valve repair. The coroner reported that he had cardiac surgery here, he would have survived. We had a baby come from country South Australia who we knew had cardiomyopathy, a weak heart. We would have put that baby on ECMO had we had the service. She died.
These are the most vulnerable pregnant women that we care, the most complex cases that we take care of. It is a very stressful time for these women. There's 3 maternal medicine subspecialists at the Women's Children's Hospital, 3 of us, okay? That is the lowest number of maternal medicine subspecialists per number of deliveries in Australia. That's the lowest number, okay? Of those 3, 2 of us are over the age of 60. We're having difficulty training maternal medicine subspecialists to take over from me or take over from my colleagues to continue that service.
The team we have here now is appropriate for the care that we could deliver 20 years ago. We don't have the number of staff available to deliver a 21st century service, let alone the world-class service that South Australian kids deserve.
The haematology-oncology unit has been decimated. Well, I think what we've actually suffered was a loss of 2 very, very senior staff, consultant staff, who have been burnt out.
And we really worry that staff who are struggling to keep their head above water are at risk of making errors. And in an increasingly complicated area like oncology, that could be a real disaster for our patients.
The frontline services, the well is dry. You find yourself in the situation in these clinics where you spend a lot of the time performing base clerical activities rather than using your medical expertise to assess patients.
As an infectious diseases paediatrician, I go across the whole of the hospital. I see all the units. And over the last few years, the common themes have just become more obvious to me that we need help. We need help with resourcing, we need help with staff, and we need help with equipment.
The thing that drives us is the care for our patients. And as a consequence of that, the care and concern for the families of those children and women.
As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honour and noble traditions of the medical profession. I will give to my teachers, colleagues, and I would say now that many of them are here today, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honour. This is a touchstone for me. I return to this over and over again and have done over the last 20 years. And I think when people ask why we're doing it, I think that speaks for itself.